My name's Jason Jarrett. I'm an exercise scientist and an exercise physiologist. Every injury is unique and every fitness goal is unique. Work with me and you'll get the professional direction you need with your situation. Hi, I'm Jason Jarrett and welcome back to another video. In today's video, I'm going to be talking about different types of pain, how we monitor the different types of pain, and pain versus discomfort. So we have a few different factors here which will affect our journey, regardless if we're on a fitness journey, if we don't have an injury, or if we have an injury and we're monitoring pain with that injury. Or both of those things. So we might have an injury and be on a fitness journey at the same time, which is often the case. Let's start with acute pain. What is acute pain? Acute pain is essentially pain that is less than 3 or 4 months in duration. More specifically, it tends to be the pain that occurs directly after an injury. So if you've just sprained your ankle or hurt your back, the pain that you feel in the first month, the first 2 months, the first 3 months, this is what we call acute pain. Now, contrast that with chronic pain. Chronic pain is essentially long-term pain. So pain that goes beyond 4 months. In some contexts, I believe it's 6 months. If it's past 6 months of pain with an injury, it's considered chronic pain. So why do we differentiate between acute and chronic pain? The reason is because the two are quite different. The two manifest differently, and the two have slightly different mechanisms. Acute pain or short-term pain has a purpose in that it can help protect us against further injury. The problem is once acute pain, or say pain less than 4 months, passes over into chronic pain, we've had it for more than 4 months, certain physiological mechanisms kick into play and the pain can become more ingrained, and it becomes more affected by things like lifestyle habits. Lifestyle habits could include nutrition, stress, anxiety, exercise, sleep habits. Overall quality of life can begin to affect the amount of pain that you actually feel. This is not intuitive. What is intuitive is most people realize what movement or exercise will exacerbate or flare up their injury, even in that chronic stage. Say you've had an injury for a year with intermittent bouts of pain. So we've got a chronic back injury, we've had it for a year. You know, if you bend down in a certain way, you get pain. Well, the thing that is a little counterintuitive is it's not just that movement or that exercise that is related to the pain. Like I mentioned, it's also those other factors. A nice metaphor here, and by this point, no doubt you realize I love the metaphors because it just makes it so much easier to explain things. A nice metaphor is that pain, or your capacity to tolerate pain, is like a teacup. If we pour too much into a teacup, the point at which it begins to overflow is when we feel pain. So the natural course would be to not pour so much into the teacup that it overflows. What's the T then? So in this metaphor, the T is all those lifestyle factors I went through: sleep, stress, anxiety, exercise, nutrition. All these things, if they're not in line, so bad nutrition, no exercise, poor sleep, all this stuff contributes to T going into the teacup until it overflows, you feel pain. So we can do that. We can put less in the teacup. What we can also do, and this is what I specialize in, is we can increase the capacity of, we can increase your capacity to before you begin to experience pain. So in this metaphor, we can increase the size of the teacup so we can put more in it before any pain is experienced. So to increase capacity, what do? We can improve lifestyle factors, or we can use exercise to improve our physical capacity. So that's two great approaches that we use to manage chronic or long-term pain. Exercise to improve the size of your teacup or your capacity, as well as looking at other lifestyle factors, which is an activity in the workbook as well, looking at lifestyle factors like sleep and nutrition, stress and anxiety, all these things to try and minimize those. So we're going to try to increase the size of the teacup and put less in the teacup. You'll have greater capacity before you feel pain and less likely to experience pain if we're putting less in anyway. There you go. So I hope that metaphor's been useful. Now, just to jump back into acute pain or pain that you might feel straight after an injury. So you could have a long-term injury or a chronic injury and then it flares up. So maybe we've gone in for too many belly rubs with that cat. Well, it's a bit of an indicator, isn't it? How painful should an injury feel while we exercise? Should we feel any pain? Let's say I've got a back injury again and I'm doing squats or I'm doing some other exercise and I say, oh, it's a bit of a twinge. So there's two things to this. How painful was the twinge? As a general rule, if it was a 3 out of 10 for pain or less, and I'm confident I won't feel painful tomorrow morning from that twinge, I'm okay. Obviously, the latter thing requires a little bit of intuition and experience with my injury, which I would have. We're tying this back to the cat metaphor that I've used before. So if I'm feeling a little bit of a twinge in my back, maybe the he's woken up, he's looking back at me, he's like, what are you doing? So maybe I'm getting a bit close. I'm probably okay if I'm just cautious. So I don't want to go too hard, too fast. So basically, it's okay to have a little bit of pain, not more than a 3 out of 10 on the pain scale. If 10 is the worst pain that you've ever experienced and 0 is no pain, you don't really want to be beyond a 3 out of 10, either during the exercise or the next morning after you've done it. So again, that bit requires a little bit of prediction. So that's acute pain, short-term pain after an injury. We've discussed chronic pain, long-term pain. Again, the chronic pain complex. We use different strategies for managing chronic pain. With acute pain straight after an injury, you might rest it, ice it, compression, elevation, physiotherapy. That's actually pretty easy to manage, a short-term injury. Chronic pain is a completely different creature. So chronic pain requires a lifestyle intervention and pain management and more education about how to manage those lifestyle factors and put less tea into that teacup, improve the size of the teacup. Great, so we've discussed that. Now in this video, there's really one more thing that I want to talk about. Muscle pain after exercise, the day or two after exercise. So a concept we have in exercise is something called delayed onset muscle soreness. So most everybody's experienced this. If you've engaged in a new activity or a new exercise that you haven't done before, you haven't done in a long time, you'll get quite sore the next day or even for the next few days if it's quite significant. So it's okay to get muscle soreness and even muscles being a little bit of pain. Again, we don't want to push that too far. We don't want you to be uncomfortable after every session of exercise or rehabilitation, but muscle pain, if it's recovering, is generally okay. What we don't really want is joint pain. So it's important that we differentiate between that DOMS or delayed onset muscle soreness, which is okay. DOMS is okay, but joint pain, not so much, and we really want to try and avoid that. So we've covered a few things there. I hope that's all clear. I'm happy to do more videos on this topic. Really important that we understand the difference between acute pain, straight after an injury, chronic pain, which has been long-term and usually with a chronic injury, so an injury you've had for more than 3 or 4 months, it's just hung around for years. They're quite common. So it's chronic pain, DOMS, delayed onset muscle soreness following muscular exercise, which is okay, and discomfort. So if people tell me during exercise that, oh, that was painful, you'll know. I stop and go, hang on a second. What do you mean it's pain? Wait a second. what do you mean by pain? Was it just sore in the muscles, which is okay during the exercise? You felt it felt tight, or did you actually have pain? So we have to be careful about discomfort. It's okay if you're uncomfortable during exercise. In fact, you probably should be. Exercise should be uncomfortable to get better benefit. Discomfort's fine. Discomfort's perfect, and we need it. But pain is something we monitor differently. So use that pain scale for me. Those with the workbook will have a little activity in there to monitor pain. Never let pain go beyond a 3 or a 4, no more than a 4 out of 10 during the exercise. If it does get that high, I start looking at alternatives or bringing the intensity of that particular exercise down. So we don't want to go beyond that level. Don't panic, but okay, it's time to pivot, reorient, maybe just leave that exercise for today and see how you recover tomorrow. And in this way, we know we've snuck an extra belly rub, hopefully without waking our cat up. Great. Well, that's another one in the bag, guys. So please be sure to comment, like the video if you found the content useful. Please be sure to subscribe to the channel. And if you'd like to reach out to me, I'm more than happy to chat. Stay tuned.